Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome Mr. Amit Shrivastava, the co-founder of GoInstaCare. Welcome, Amit. How are you today?
I'm good. Thank you for inviting me.
Our pleasure, our pleasure. Well, full disclosure, we've known Amit for, maybe 11, 12 years now. He's a good friend of ours, and he and his wife actually owned a very successful home care company in Illinois, and of course we're in Michigan, and we've gotten to know you over the years, Amit. You had to sell your home care company. We'll talk about that shortly, but you are now launching this, I call it revolutionary app for families and caregivers called GoInstaCare. Let's start with you sharing a little bit about yourself.
Sure. Thank you, Lance. That's a good introduction, and just wanted to happy to be here. My name is Amit, and I'm a co-founder and CEO of GoInstaCare. And before starting GoInstaCare, we had a successful home care company, like you mentioned, in Chicago. And my wife and I started it from scratch and made it successful. But unfortunately, we had to sell that out because of our son's health. And then we moved to Austin. His body didn't like cold, so we had to move to a warmer place. And now I'm trying to set up this new company, GoInstaCare, which is gonna, like you said, revolutionize the home care space and save a lot of cost and time for families to find quality care.
Yeah. So I want to, before we get into more about GoInstaCare, when you ended up having to sell your home care company, that was pre-COVID, correct?
This is pre-COVID. Yes, correct. Correct.
And I'm sure, you're given, with the work you're doing with GoInstaCare, you're kind of staying up on the news and the trends and all of that. But, one thing for us with our company, COVID really introduced home care as an option to people that otherwise never knew about home care. But another thing that it did, though, across all industries, I don't think just home care or healthcare in general, it's really caused a labor crisis, a labor shortage. And so would any of that have influenced you if you had not had to move due to your son's health with your company? Or how do you think you guys would have managed?
I think we were doing great, but I think you're absolutely right. That would have caused a lot of this labor problem for all of us, right? Nobody wanted to get out. Nobody wanted to be in touch with anyone. It would have caused an issue, but before, I think this was in 2018 when we sold the company. So this was way before COVID. And if we had stayed with the business, I think we probably would have shrunk our company, or our company would have shrunk quite a bit because of all this. And it could have created issue for the seniors who we were serving. So definitely it would have made a change.
Yeah. And, I tell people all the time, we really consider ourselves very fortunate. Some companies in our area, they lost all of their staff. We were able to get through COVID pretty much unscathed. We didn't have any labor issues. But one thing that we've seen is a lot of the workforce in healthcare, your retail, your banking, restaurants, and obviously home care, there's a greater need for these services now because a lot more people discovered that this was an option. But we're not we as in our company, but just we as I think society in general, we're seeing that we're not able to meet the demand. We can't keep up with the demands because it seems like a lot of the people,
absolutely.
So, hopefully we'll see that trend change in 2024. But I want to start talking about GoInstaCare. We've talked about it about a year ago, and you've now got it out there, and I'm hoping it's doing successfully well for you guys. It's really a remarkable program. But what is Instacare, and how did you go from selling your home care company, moving, and then deciding I want to kind of get back in the industry, but in a different way? And you came up with GoInstaCare. So share a little bit about that with us.
Sure, I think that's a great question, and so GoInstaCare is an award-winning, actually, to your point, right? It's successful. We just won an award in 2023 for being one of the top 10 mobile health solutions in the care industry. So very excited about that. So what is GoInstaCare, right? GoInstaCare is a search platform where families can find caregivers quickly. And the platform works on a very unique concept called personality mapping. Personality mapping is very similar to your Match.com concept. And our belief is that when you are working with someone for 8 hours, 10 hours, there has to be some chemistry. And that's what we work towards. The platform focuses on finding the right caregiver for you every time. And then in terms of how we got started, right? So the platform, basically how we got started was, I was talking to my wife one time, and we were talking about the problems that we had in the home care industry and the challenges we were facing when we ran the home care company. And at that time, while talking to her, we figured, why not find solutions to those problems that exist in the industry, right? Low pay for caregivers, high cost of caregiving for seniors, long time to find a reliable caregiver for the families. So why not solve all of these big problems with something, right? So we came up with an app that works, like I said, on a personality mapping concept. It saves cost and up to $20,000 to seniors. And it makes a lot more money for caregivers because they can choose their own price. And caregivers can be found instantly on the app. So that's how the GoInstaCare platform was born.
Wonderful. So I want to, if you don't mind me asking, so for viewers and listeners who maybe they're familiar with care.com, right? And I know you're probably familiar with care.com, and you go on and, you put in the hours and the days and what your needs are. Then they give you, options to choose from the family standpoint and from a company standpoint. How would you say this is differentiated between care.com and GoInstaCare? Like, what separates you from that? Like, what makes this different or more unique?
Absolutely. That's a very good question, Lance, and I'm glad you asked, right? So GoInstaCare, the name suggests Insta, right? So it's an instant service. In care.com, when we were home care agencies, we used to find a lot of complaints about that as well, but it's a great platform. But what it does is it allows you to post your job requirement, and then a lot of people apply to that job, and then you go through a lot of these profiles and try to figure out who the right caregiver is. You talk to those caregivers, you try to interview with them, bring them to your home for in-person interview. It takes about 10 days to find the caregiver on average. There's a study done by a very famous company in home care segment, Home Care Pulse. According to them, it takes about 10 days to find a reliable home care service. So what we have done is, on our platform, it's an instant service. So when you put in your requirements, when you say, I want service for this person in that location for this much price, and this is the personality type that my family member has, the app gives you a list of caregivers that are ready to talk to you right now, just like an Uber concept, right? When you create a request, Uber app starts looking for all the drivers that are available to work right now. Anybody who's offline at that moment will not be shown to you in the list. That's what we do. So we are making it instant, whereas care.com is okay for someone who's looking for a caregiver maybe 30 days down the line, or they're okay to go through a lot of search and they have to talk to a lot of different people. So if they have time, they could potentially use care.com. But if they want someone right away, GoInstaCare is the answer. Think about it as If you have a regular caregiver, they cancel last minute. We used to get a lot of those calls. I'm sure your company gets a lot of calls, those type of calls that, hey, my caregiver quit on me, or they're sick, I need someone right away. In those times also, caregiver GoInstaCare can come in very handy.
So I know if as a family and, with our business, we get this question all the time. And if I was on the family side, I would ask this question. The caregivers that families can find on GoInstaCare, are you vetting them, doing background checks, checking that they have, like how extensive is it?
Oh, absolutely. Yeah. Every caregiver that we display on our platform is background checked. And when we are also working on figuring out the training program for them. So like you know that running a home care agency gave us an idea of what is being done for a caregiver before they're sent to the family, right? Mainly documentation, training, background checks, drug testing, and then ensuring that their personality is mapping, right? That's when you are sending the caregiver to senior's house. So we're trying to bring in all of those features into this app and automate the whole process. One of the things that we want to do going forward is bringing this training program also. I'm talking to a great company to bring it to integrate their training program with our app, and the caregivers can then finish the training, and then it will show up on their profile that this person is trained.
Wonderful.
So that is another thing. Then another thing that I'm working on right now with a company, we're trying to figure out how to bring that program into our app is drug testing. So we're trying to figure out if there is a way for families to do instant drug testing through those mouth swabs. I'm sure you've used that for your company, where you can do a mouth swab and it gives you results in 5 to 10 minutes. So that is also something that we're looking into. So we're going to do everything possible to bring in the trust and get the caregiver to you that is qualified and reliable.
That's wonderful. What are some of the feedback that you've been getting from your users, either caregivers or families? And I think you might have sent us a couple of testimonials too. Is that right?
So the caregivers have given us great rating. Some of them are satisfied. Some of them are not very satisfied because the care doesn't exist. The clients don't exist in their area, and that is a part of building a business from scratch, right? You're trying to build the caregiver database, and then on the other hand, you're trying to build the client database, and there has to be enough caregivers in a state for us to go to that state. So we're going step by step in each state. Right now we're in Texas, so majority of our caregiver data is in Texas. And once we have more and more caregivers join our platform, we'll expand it to other states as well. So the feedback has been great. If you look at our Google rating, we have 10,000 plus downloads of our app, and we have about 4.1 rating in that. And some of the low rating that we've got is from the people who don't see any jobs, and that's because we are not live in their states yet.
Sure. How about family testimonials? Did you send us a video, I believe, of user testimonial?
Not yet. We have not sent you the video of that, but it's a video of the app, what the app does.
Okay.
So the video that I sent you is the video about explaining the concept of the app.
Yeah,
for clients.
Well, let's play that video. I knew we had a video here. Let's roll that right now for our viewers, and listeners can listen in.
Tired of searching for affordable senior care options? Have you been talking to a lot of babysitters but finding it too difficult to decide the best one? Or are you overwhelmed with schedules and need a hand for errands, pet walks, or house chores? Well, whatever is your care dilemma, GoInstaCare is your answer. GoInstaCare app connects care seekers with excellent care providers at an affordable rate instantly. Plus, all care providers on our platform are background checked and rated by real people just like you. Even better, GoInstaCare app lets you talk to care providers right away and get to know them better before you hire them. Visit our app store today to download GoInstaCare app and find amazing care instantly.
So talk to us about what we just watched.
Sure. So I think you've seen what the platform can do for our caregivers. for our clients. It helps clients find caregivers instantly. The caregivers are background checked. They get feedback by the real people. That feedback is going to be displayed. And we are trying to find right caregiver for you every time. And these caregivers are live to talk to you. So you can talk to the caregiver beforehand, before you hire them. So a difference between, I gave you the Uber analogy, right? Yeah. So the difference between Uber and us is Uber sends you a driver by themselves, right? You send a request, whoever is available, they send it to you. But in our platform, since it's more personal care, personalized care, you stay with that person for longer time. We display a list of all the available providers to you, and then you interview them by calling them through a video call. And if you prefer to bring them to your family and in-person interview and all, that would be a great way for you to just do a preliminary check. If you like their personality, if you like their if you think that they're qualified, you can actually bring them to your home and say, okay, I want you to meet with my mom and dad and see how it goes, and then we'll make a decision. So there's a way for you to hold that hiring process till you have introduced them to your loved one, and then once you've made a decision, you can send a request through the app. The caregiver can actually accept the request. Here's a cool thing about it, though, Lance, is sometimes caregivers don't say it in front of the family, but they don't want to work with the family sometimes, right? Not always, but if that compatibility from family side is there, but caregiver doesn't think that they want to work with them, our app actually gives them an option to decline the request, which in home care scenario doesn't happen. A supervisor says you have to go here, you basically have to go there, right? So in our case, the caregivers are also treated like they have a right to say no. So if they don't like the family, they didn't say it on their face, they have the option to say no on that request. And it doesn't take anything, it doesn't ding them for saying no to accepting a job, right? If they accepted a job and then they canceled it, then yes, obviously their rating goes down in our app. But if they say no to accepting a job, then absolutely that's their right. They just don't want to work with the family, so that's okay. And it's a good thing because the caregiver is not wasting family's time either, right? So it's definitely a win-win for both.
I want to real quickly before we move on, Amit, how do you? I don't know if this is something you handle or if the caregiver or the family, liability insurance, bonding, workman's comp. How is that handled on the app?
At this point, we don't have that built in. We expect the families to take care of that at this point. Okay. But there is a model that I have planned for future, where we are going to. There's a company called carelinks.com. They used to have an umbrella coverage for all of their caregivers. So we are going to look into that as well. And that's a big problem to solve, but we do know that type of solution exists in the industry, and we'll be looking into that as well. But at this point, to answer your question, the family will be taking care of the insurance piece.
Okay. Yeah. Thank you for sharing that. I know, listening to you, with your experience, our experience, one of the things, and I'm not sure how you guys did it with your home care, we always tried to match the staff with the family based on, personality, their experience, their qualifications. But we have found, at least for us, we can present options to staff, but we don't make them take it, because for our, at least our perspective, we feel like, if you're making somebody go to a house that they don't want to go to, it's just a disaster waiting to happen. And I think for our staff, they've really appreciated that aspect of it, because they have had experiences with other home cares where they didn't have a voice, they didn't have any individuality on making decisions. But, again, everybody has different philosophies on doing things. But I think it's helpful, that they are going where they want to go and they accept going to, rather than just enforcing it, because I don't think it's going to be beneficial to the staff or to the family they're helping. I know you've mentioned. Go ahead.
Absolutely. Yeah, absolutely. I mean, you've got great experience, and that's a wonderful thing you did, right? Or you're doing still. Asking the caregiver that, hey, this is the type of client, and would you like to work with them?
Right.
And allowing them to choose rather than say, okay, go here, go there, do this work, do that work, right? So in our company also, in the home care company also, we had a list of questions we used to ask the family, and the feedback that we got, my goodness, the questions are awesome. None of the other companies that we have interviewed with have asked anything about my mom or dad. What is their personality? What type of food they want to eat? What kind of person they like to gel with? Can you give us an example of their friend that they used to hang out with? What type of personality that friend had? So things like that make a lot of difference, right? If, for example, if you have a caregiver who likes to talk about gardening, for example, and a client who likes to talk about sports, if you put them together, the conversation will be over in 30 minutes, right? And then they'll be twiddling their thumbs. So we want to make sure that this is a pleasant experience for both, because if the caregiver is not happy working with the client, they won't go the extra mile, right? And we want every caregiver to go the extra mile, and that magic happens only when there's compatibility, there's chemistry, and then there's a bond between the caregiver and the client.
Absolutely. And I think that's also home care done right is doing those exact things. I tell people all the time, home care is meant to be different than being in a nursing home, in rehab, a hospital, where you really have no say in who's walking through the door to help take care of you. They are there, they're taking care of you. Home care, we tell people you're the ones in charge. If you say you want this, or that, well, you have that right, and we just help to facilitate it and make sure you're getting the highest level of care possible. And I knew you guys, did those extra little things that make all the difference like we do. Let's talk about, though, the problems. I know you've mentioned several of them, but, with GoInstaCare, what are the problems that you're trying to solve?
Yeah, it's a good question. So one thing I mentioned, right, we want to lower the cost of home care for seniors. We think, based on our calculations, we think that we can lower the cost up to 50%. And we want to reduce the time to find caregivers from average 10 days to maybe 2 or 3 hours by providing you the care that matches with you, right? Like I gave you the Uber analogy. You have a caregiver who's ready to talk to you, and you interview with them, you do a video call, you like them, then you bring them, if you want to bring them to home, great. If not, then you can just say, okay, let's start. This is our schedule. This is what we want to do. These are the things we want you to take care of. And if the caregiver is okay with that, they send a request, and voila, you have a care provider that is ready to work with you, right? The other problem that we think from the caregiver side that we want to solve is a lot of these caregivers are struggling, right? They're struggling with increasing cost, inflation. There's so much going on, right, in the economy, and they struggle. So I've seen a lot of caregivers want to get paid, or they've said that, can you pay us weekly rather than bi-weekly, right? The trend is bi-weekly. Sometimes some companies are doing the right thing by giving them pay weekly, but we think that if an Uber driver can get paid instantly, why not caregivers? Sure. So in our app, once they finish the job, the client is then the client will be paying them through using our app, and we have made it very flexible for a client to pay through the app. They can use PayPal, they can use Cash App, they can use Venmo, they can use any of those apps to pay, and or they want to use a credit card or check or something, they can do that as well. And the caregiver would be happy, and the client is going to be happy that they got the care. So the 3 things that I covered as lower cost for seniors, reduced time to find caregivers, and then quick pay for caregivers. These are the 3 main things that we're working on, and there's a lot more things that we have in the app. I can't cover all of those here, but definitely these are the things that we want to solve.
Do you have a timeline? And maybe you can't even say, but what is your projection for when GoInstaCare might be available in more of the states?
So this year we want to focus mainly on the first half of this year. We want to focus mainly on Texas, and then slowly we want to increase our horizon, and we want to go to Florida and then Illinois and Arizona. These are the 4 states we're looking into for 2024. And then as soon as we are live there, we have had our experience. We remove any of the kinks that exist in the app, if there are any, and we want to get some real feedback from all the clients as well and the families. And once we have built all of that, then we want to open up the app for throughout the U.S.
Wonderful. How would you say your idea or GoInstaCare is not only benefiting caregivers but also the care seekers? And I know you've kind of alluded to it, just the instant, almost need being met. But are there other ways too, Amit?
Yeah, absolutely. So there are many things, right? So finding the affordable, reliable caregiver and finding the caregiver quickly are some of the things. But like I touched upon, saving $20,000 per year these are averages, right? Up to $20,000 a family can save by hiring the caregiver directly, because there's a lot of overheads that agencies have to bear to run their company. But in this case, since you're hiring the caregiver directly, those overheads are not there. So if you think about a senior living or requiring care for 5 to 7 years of their time, let's say 5 years in their life, that's $100,000 of savings, right? So that's a huge saving that a family can see through the app. Then the other thing is, in the industry, like you touched upon, what is the difference in Care.com and GoInstaCare, right? This is another very big difference between Care.com and us, is Care.com ends when you have found a caregiver. Let's say you found a caregiver, you message them and they want to work with you. That's where the Care.com solution ends. Our solution is end-to-end, from hiring to care history. So you hired the caregiver, now what, right? So on Care.com, you don't have a way to manage that care afterwards. On our app, the caregiver is gonna get a notification when it's time for them to start working. So when they say on my way, then the family can actually track the care provider. And if the care provider hasn't clicked on my way an hour before, the family is going to get a notification that, hey, your care provider hasn't even started from their house. So you either call them or you try to figure out what's going on, if they're going to show up or not, or you have an hour to figure that out at least, right? It's not like after the fact. So there are many cool things that happen within the app. So it's an end-to-end solution, right? In addition to that, you have the whole history of care, the type of care that the provider is providing. They're going to enter all of that in the app, all the tasks that they have performed. So you kind of know when the exercises were done, when the pills were taken, and stuff like that. So a lot of things that you are going to have a history of, and then you're tracking the care provider in real time when they're starting from their home. So that is another cool thing. And then secure payment, like I touched upon that as well. You're free to pay through PayPal, Venmo, Cash App, check, and all that kind of stuff. So there are a lot of cool things that this app covers for a family.
So after, let's say I'm a user, I go on and I find my caregiver and they agree and we connect and we make a match, if you will, and I hire them. So now it's going from being a hiring tool to now it's also a care management tool as well?
Absolutely. Yeah, so that's very cool that we wanted to solve the end-to-end problem.
Yeah, that's incredible. I want to talk a little bit more about...
Sorry, you cut off, Lance. Can you repeat that?
Yeah, I want to talk a little bit more about the personality mapping. Walk us through, and I don't want you to divulge any, state secrets or any of your secret sauce, but that personality mapping, with all the stuff that AI is doing now and all of these different, algorithms, what's the success rate? And walk us through like the process. If I'm going to, sign up to be a caregiver on GoInstaCare, how do you map my personality? Do I take a lot of questions? Walk us through that.
Yeah, absolutely. That's a great question. And I'm glad you picked up on that. Personality mapping is where, we're trying to match a senior's personality with the caregiver's personality on various factors, right? We ask a lot of questions when a user is creating a senior's profile. We're asking them what type of personality does the senior have? What are their likes and dislikes? Dislikes is actually very important for us to know what they don't what they dislike, right? There's many other things. There are many factors that we gather when a client or a family is creating a seniors profile. And then similar questions we ask from the caregiver. Are you a smoker? Are you not a smoker? Are you, what kind of, what hobbies do you have? What are your dislikes? Are you comfortable with pets? There are many other things that we ask the caregivers while they are creating their profile, and that gives us an idea about what kind of personality they have. And then in addition to that, there's a lot of things that we collect at the time of feedback also, right? So then we create a score of all of this thing, and then based on those scores, we try to figure out who's the best match and try to rank them higher. And then that's how the sorting is done. So we are going to bring in some of the AI features also. I'm going to talk about that as well. But the AI features are going to ease this whole process of data entry as well.
Wonderful, wonderful. You want to talk a little bit about how AI is starting to play a role in the care industry and what you're doing with it?
So there's a lot of people doing a lot of cool stuff with AI, right? There's all kinds of monitoring devices that are coming in. There's you can speak to things. There are virtual caregivers or virtual caregiving devices that exist nowadays for dementia and Alzheimer patients. So a lot of cool stuff happening through AI, right? And what we are also thinking about, one cool thing that we want to do is we want to use machine learning to improve this care mapping methodology to make sure, just like how you if you think about this as your Match.com, right? Or there are other matching sites, right? In those things, once you enter your profile, they give you 2 or 3 top matches. Okay. And generally those 2 or 3 matches are very compatible, and when you meet with those people, you feel like, wow, this is my soulmate. This is the person I wanted to, I enjoy talking to, and that's the kind of thing that we want to do. So if when I joke to my wife with this, that hey, we're building an Uber with a hint of Match.com, right? So we have a platform that is going to work like Uber with a hint of Match.com. So that's exactly what we want to do, and with AI, we want to actually improve this matching technology as well as data entry portion of it. Right now, you're clicking on everything. Later on, we'll be asking you questions verbally and then filling out all of that information. So it's going to be a lot easier for everybody to just fill up their profile and if they want to increase more questions, we can, right? So it's going to be a lot easier.
Wonderful. You mentioned earlier, Amit, and congratulations again on winning the award. How are people finding out about GoInstaCare? Like, is it through Google? Like, how are you getting the word out there?
Yeah, so that's we are on all social media platforms. We have a great social media person who helps people get aware of GoInstaCare. They can actually go to our website as well. And we have a YouTube channel where we are posting some of these videos and other feeds also. And they can download the app also through any of their Google or Apple stores. For clients, the app is called GoInstaCare, and for caregivers, the app is called GoProvider.
GoProvider. Share with us really quickly, and we'll put it up on the screen. What's the official website for GoInstaCare?
Yeah, so the website is called GoInstaCare.com.
Okay, perfect. And then we'll have all that in the show notes, as well as the links to all of your social media and your YouTube channel. What kind of videos do you guys do on there?
One more thing.
Yeah.
Are you asking? Say that one more time, Bo.
Your YouTube channel, we'll have that in the show notes as well. What kind of videos do you guys post on your YouTube channel? Are they educational, or are they about the app, or?
They're mainly about the app for now.
Okay, wonderful.
I want to play one more. I want to play one more video, if that's okay with you, from the caregiver side. So I think we talked about the video on the client side, but we have something very cool for the caregiver side also. And it covers how they can, when they sign up with the app, what kind of benefits they get.
All right, let's play it right now.
If you are a caregiver looking to boost your income, get the flexibility to work whenever you want, and get paid daily, look no further. Introducing GoInstaCare, a revolutionary platform that connects technology with care to create a community where the perfect care seekers and care providers can find each other instantly. All you have to do is sign up on the app and complete a background check. You can then choose your own schedule, set your own rates and client preferences, and even talk to the client or family before accepting work. Sounds amazing, right? So, download the GoInstaCare app from your app store and be your own boss today.
So just like what you saw, right? The app actually helps the caregivers be their own boss, right? It boosts their income by allowing them to choose their own rates. They can choose $15, $20, whatever they like per hour. And then it gives them work-life balance. So think about, and they can work from anywhere, anytime. Think about it, a scenario where a caregiver is right now in Austin, Texas, and they want to move they actually move to Dallas, right? So in those cases, now they have to give up the job in Austin. They have to find a new job in Dallas, right? They need to figure out who the companies are, which is a good company, who's giving best rate and whatnot. Whereas in our app, they simply have to change the address, and now they're going to start showing up in Dallas clients list. So they don't have to do anything at all, right? All they have to do is change their address, and they start getting new jobs. So that is another advantage, and faster pay, like I talked to you about earlier. They get paid after they finish the work, and then they get the flexibility of choosing whatever client they want to work with.
Wonderful. And I just want to go back to the app and the website. Can caregivers or families, can they sign up and match and enroll going through the website, or is it only for the app?
It's only through the app at the moment. The clients and the caregivers have to download the app. There's a link on our website where they can download the app, and they can even search the app through the Apple Store or Google Store.
Wonderful. Now I want to get to something that I know a lot of families are probably wondering, and probably even caregivers. Is there cost associated with using the app?
Absolutely not. This is a free app at the point. The caregivers are not charged anything at all. The clients even for clients, the app is free. Even for caregivers background checks, we don't charge anything. And we're actually working with the company to see if we can bring in the training for caregivers for free as well. So if we could do all of that, that's what we're working towards. So wow. No charges at all for using our platform.
That's incredible. What about the future, Amit? Are you guys working on any features to add some more value to these users, caregiver side or the family side?
Yeah, absolutely. So I think we talked about AI side. There's another thing that we want to bring in for people who want to post a job for later use, right? So they don't want an instant service. They may be looking for something later on. So we're bringing in that post a job feature as well very soon. And then there's a very cool thing that we have thought about, which came about as a idea sharing session within our team, is friends rating. So what is a friends rating? So there's a generic rating that you will get for a caregiver, but then on the side you will also see if you shared your profile and your friends' information or you gave the Facebook link to our app, we'll be able to give you a friends rating also. For example, if you have used a caregiver in the past and you gave them, say, 3 rating, and their rating overall is 4.5, you would probably trust your friends rating more than the generic rating, because you know that this person, and then you have the ability to find out who that friend is who may have used this type of caregiver, and then you talk to the friend. Just like if, let's say, you want to buy a cell phone, right? You have multiple choices. Let's say you decided on buying an Android phone, but even then, out of Android, let's say you have even honed down on buying a Samsung phone, but then you want to find out which Samsung phone do I want to buy, right? So one thing is, you can look at all kinds of Amazon ratings and Google ratings and all that, but then you're still confused. Right. If you had a friend that have used that phone already, then you would say, okay, what do you like about it? What do you not like about it? What do you think is 5 point something rating fair, or 4 point something rating fair or not, and stuff like that. So you would trust more on what your friend is saying versus what the generic opinion is. So that's why we think that when it's such a personalized thing, if you had a caregiver rating given by your friends and that is being displayed, we think that personality matching, in addition to personality matching, this friend's rating will also come into picture, and we think that compatibility will increase even further.
Wonderful.
So there are a lot of cool things happening on our side.
That's very cool. Well, it's incredible. You've come full circle from home care company to now, connecting the caregivers with the families that need it. A lot of similarities though, right?
Yeah, absolutely. I mean, that's the whole goal, right? I had a corporate job. It was a very well paid job, but I didn't want to sit in the cube and crunch numbers. I wanted to help people, and I think this is my way of saying thank you to God for such a blessed life. So I definitely want to make sure that we fulfill that purpose and help the families and the caregivers together.
Yes, and we've like I said, Amit, we've known you a long time, and you're a wonderful person, and I will tell our viewers and listeners, I mean, you're definitely doing it for the right reasons. And, you and your beautiful family, your wife is a nurse as well. So, I mean, you guys have that extensive healthcare background in the family. And I think this is going to be revolutionary. I just, listening to it even further today with this interview, it's ingenious. But at the same time, it's one of those, you're very welcome. And at the same time, and I mean this as a compliment, I'm thinking, it's so simple. I can't believe something like that hasn't already been out there. That's the thing. And I'm glad to see you're the one bringing it to the industry. And I think it'll have just an incredible positive impact, both for the caregivers and for the families. I encourage everybody, go download the app, or, reach out, contact Amit, go to the website as well, GoInstaCare.com. We'll have all the links and everything here in the show notes. And it's always a pleasure, my friend.
Thank you, Lance, and it's a pleasure to talk to you as well. If viewers want to talk to us directly, or they want to reach out, they can simply use our contact us form on the website, or send an email to support@goinstacare.com. We'd be happy to answer their questions as well.
Fantastic. One last question, and we're gonna of course be talking before this, but I'm quite fond of asking this question of people who are developers, inventors, or they have products or what have you. If we didn't talk, Amit, and we ran into each other 5 years from now, where's GoInstaCare at that point?
Oh, it's going to be awesome. It's going to be, it's going to be across the U.S. and the family is going to love it. We're going to have so many cool features. I think we're going to be competing. We're going to be giving good competition to a lot of these home care agencies, and save costs to a lot of these seniors who are really sometimes struggling for money, and even the caregivers who are also struggling for money. We think that by saving costs for our seniors and for making more money for caregivers, this is going to be definitely a preferred choice for our users.
You'll just stay out of Michigan, though, right?
Absolutely. If you'd like me to be, I can do that. You're a good friend of mine.
No, I wish you guys nothing but the very best for you. You guys, it's so well deserved, and you're wonderful, and your family, and just appreciate your friendship, but also appreciate you taking the time to come on today to share this incredible resource with our viewers and listeners. So thank you, and we'll talk soon.
Thank you, Lance. I appreciate your time.
Our pleasure. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms, or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Mr. Amit Shrivastava for joining us today to discuss GoInstaCare. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.